Perfect, thanks. Good morning, everyone. And I consider this webinar series to be very timely and prestigious. And the Norwegian e-health research center that I visited for a few weeks, 2 weeks ago, I think I arrived back to Oulu to be one of the world's leading players in this field. So it's a privilege to give this presentation. I'll try to be relatively brief. Let's see how I managed to do it, since there's a lot of things going on in Finland and in Oulu. And I'll try to be explicit as possible and use common terms so we can all understand each other. So my name is Timo Tuovinen. My background is in clinical medicine and translational neuroscience. However, for the last 7 years or so, increasingly about digital health. And my home is both physically and mentally in Oulu, Finland. And I think that's the most important thing to disclose. The others are here. I'm employed by the University Hospital that I'm talking about, and partly with Finnish Medical Association, and got some funding for travel and expenses on lectures and also research funding. We are also starting up a small startup on AI that I'm going to talk a few words if we have enough time for that. And the two most important disclosures are my perfectly beautiful and amazing sons who are there in the Tromsø visiting when I was there. I can't start without noting the Gartner hype cycle that most of us know. And I believe that we are currently near its peak. And on the other hand, we have to remember that we usually overestimate short-term change, but underestimate the long-term change. So I think we should be cautious. Still, I'm quite confident that the AI-related innovations will bring meaningful change to healthcare and society, though likely not the way that we imagine today. These are the contents of this presentation. First, let's start with a few words about my home. So this is Oulu, located over there with the arrow. And as you can see, it's quite flat. The North Ostrobothnia is the area that we serve in the University of Oulu Hospital. It means the northern former seabed. There are a few figures about the University of Oulu. It's about the same size as University of Tromsø. It's a multidisciplinary university, and it's one of the 5 universities that has a medical school in Finland. And I think that we have managed to do quite well for peripheral, quite small university. In Shanghai ranking, telecommunication engineering was actually achieved its highest placement last year. It ranked 30th among the all affiliated universities, and within Europe it was the 4th, and among Finnish universities it was the top ranked. And medical school has done quite well also. I'm affiliated to both of these organizations, and the collaboration is highly productive, as we can see in the further presentation. I would like to even state that the one would not exist in current form without the other. This is our university has 2 campuses. This is the healthcare campus, Kontinkangas, near the city center of Oulu, and there's the University Hospital. We are actually now demolishing the old buildings over there and building new ones. These are the A and B, which are the new buildings. And the aim of this is to have the world's smartest hospital by 2030, but let's see how it goes. 2 years ago, there was the largest organizational reform in Finnish history. It was a huge year for all of us working in healthcare. We used to have more than 200 organizations in healthcare, social care, and rescue services, and we changed all of this to 21 well-being service counties, which are responsible for organizing social and healthcare and rescue services for the area. There's an exception, city of Helsinki, the capital, and the Åland Island. They do not have welfare counties. It's organized by differently. And all this is publicly funded. And this is the Pohde area, the North Ostrobothnia area. And this is the area that we serve. It's area-wise the half of Finland that we call collaborative area for healthcare and social welfare, YTA-alue in Finnish. A few figures about Pohde. It serves about 420,000 inhabitants, and the number of personnel is about 8,000. So It's one of the biggest employees in the area. We also have this Oulu health ecosystem, which combines research, innovation, health and social care providers, and companies related to these. And there's a lot of stakeholders in the area, and the work has been quite fruitful. There's a long history of doing these things in Oulu. Even in the 90s, we began with telemedicine, teleradiology, and electronic medical records. And one thing to mention that we are proud of is the Momeda. It was EU-funded project that produced world's first healthcare mobile application in 98 and 2000. Two professors to be mentioned from our university is Ilkka Wimblad. He was the founder of the Telemedicum group that I belong to, and he was de facto the first professor of clinical telemedicine in Finland. And the other one to mention is our current professor, Jarmo Reponen, who was awarded Louis Loring Lifetime Achievement Award by the International Society for Telemedicine and e-health 21. Just one thing to mention. We have a long history of doing things, both in the University Hospital and also in the University of Oulu. And as mentioned, there's a lot of collaboration going on. For example, has developed our own web-based electronic health record system, ESCO, starting from 96. And now it's fully implemented, and it's going actually, because of these well-being service counties, it's going for the whole area now. GPs also, the primary healthcare. And from the university perspective, we have had this Fin Telemedicum group since 2003, and it has been doing national and Nordic monitoring studies in e-health. We also have, besides medicine, biomedical engineering education going on in Finland, and few quite big research projects or profiles of the university going on, namely digital health, relating to this topic today, but also previously 5G and now 6G flagship. And we were the leadership in National Meddigi project for medical education. And as mentioned, there's a lot of going on in the well-being service counties nowadays. Okay, few words about AI in Finland. We have actually, it's a short history, but still a long history. So the presentation is short, but the history is long. So in the 80s, there was first hype in AI in Finland. You might actually state that. And Tekes funded, I think this was the first project. It was Finprint IT in the 84, even before I was born. And 2 out of 5 the sub-projects were related to AI. There was AI and pattern recognition applications. And 2 prestigious sirs to mention is Seppo Linnaima and Teuvo Kohonen. In our university, Matti Pietikäinen started machine vision research in the 1980s, and he was followed by Olli Silveen. And my previous, as mentioned, was neuroscience, and we had a close collaboration with Professor Tapio Seppänen in technical department doing physiological signal analysis. And these are the things that Oulu has been managed to do in related to AI previously, and the link leads to this book that summarizes this. This is from the European Parliament. So the topic is artificial intelligence in healthcare, and the first figure is the relationship between AI, machine learning, and deep learning. And nowadays we can't go without mentioning also these large language models, which has caused this. I think it's hype, but let's see. There's a lot of going on, as mentioned in Finland. One is Silo AI, which was bought by AMD a few years ago. And Peter Salin stated in this book, State of AI in Finland 2025, that we actually have quite a comprehensive national AI infrastructure. We have supercomputers. One of them is Lumi. We have this new Ellis Institute, and we have key actors such as AI Finland and Finnish Center for AI. And we also have quite a good startup ecosystem going on, especially built around Slush event that is internationally recognized, and the Finnish entrepreneurs develop innovative products in various fields. However, the trend is declining in a way. This is from the same book, and it shows and it states that for example, one of the follow-ups, Tortoise Media follow-up, we can see that in 1 year Finnish ranking dropped 5 places from previous years. So there's the things to do. On the other hand, it might not be that we didn't do as good as previously, but some of the other players did much better or took up. There's a lot of going on in healthcare also, and there's, as mentioned, these well-being service counties. It makes it a little bit easier to follow up this because we don't have to follow up 200 organizations. Now we have to follow up 22 organizations, but there's a lot of going on. A few weeks ago, they published a new follow-up stating that there's 208 projects going on in these well-being service counties. And this is a list of the well-being service counties, and these are the in preparation projects, ongoing projects, and the projects that are ready. And the Nord-Finland is in Finnish Pohjois-Pohjanmaan hyvinvointialueet, which is in the third, which is quite nice because we are not the organized-wise the third biggest, but we are managing to do quite well, even though. And next to the main topic, which is the projects in Oulu. And this is the summary of them. The ones that are in those tilannekuva, the follow-up, there are 20 projects going on. Most of them relates to treatment and diagnostics, but also a third goes to support functions, and the other are in self-care and service, management and prevention-wise. And a few examples that I want to go through. First one is Pohde AI, which is a large language model like based AI medical scribe. It started with the question that how could artificial intelligence be used in the future as part of as an integrated part of the patient information system. And we started AI DocLog project, and we saw that this was the low-hanging fruit. This thing has minimal regulation. We don't have to have a straight connection to the patient information system, and this might be something that supports healthcare and social professionals through automatic AI-generated discussion summaries with patients. It was Sitra, which is the Finnish Innovation Fund, and Pohde funded development project last year, and the Sitra funding part ended in 1 year ago. Pohde and University of Oulu began collaborative research with this project, and we also involved the ESCO Systems, which is the developer of the electronic medical record system. It was first studied how well cloud-based AI, ChatGPT, performs in creating electronic health record documentation based on patient simulations, and then we went to piloting in real patient work. And it also included physicians, but also nurses, and now also the social security services or social services. And to be able to use this tool, it requires approximately 1 hour of information management training before you can participate in this pilot. And now we have changed the name, since it's not only doctors, but we wanted to emphasize that it's for the whole area. So it's Pohde AI. And as mentioned, it's large language model based AI for documentation assistant as an AI medical scribe. And it's considered to be like an easy piloting for AI in healthcare. And what it does, as mentioned, it summarizes and structures the conversation between the professionals and patients. And the AI output is displayed for the profession for checkup, and after that copy-paste to the EMR system or EHR system. Originally, we had this type of solution. The application records the conversations, sends the audio to language model for transcription, the Whisper AI, and second model condenses the transcript of the clinical text, which is the ChatGPT. And it's modular, so we can change the different part if something else works better. And this AI-generated data is not transferred directly to patient information system, as mentioned, shown separately. Perhaps in the future, if this comes as a good idea, then we can matchmake those two things straight away. Data is transferred securely from Pohde network to Pohde's Azure tenant for analysis, as seen here. Both Whisper and ChatGPT are located over there, and selected implementation style support running various localized purpose-tuned language models on an AI platform. And all this is DPIA, or the DPIA has been performed all for this. Now this is the current version. We found out that the few things to learn from this project was that audio quality is crucial. So you have to have very good microphones. We now have these stable microphones from Yapra. Also, we found out that if you have the whisper in the Azure tenant, then it's quite slow and the physicians don't have enough time for that. So we have transferred it to local server, and the summary quality is much affected by AI control. So we have to have, if you have played with ChatGPT, you have to have good prompts. And also you can adjust the so-called temperature, and also the token count and input length. Those have to be taken in consideration. The results of this project is that AI can support documentation and may save time. And however, these time savings are not the only thing to consider, because as the traditional way of documentation, it's actually a reflective process which supports deeper understanding of patient encounters. So it's not only about documenting, but also thinking about what's going on with the patients and that sort of stuff. And it's also enables critical review of care and decisions. And it also helps to build a memory trace for the professionals. A few drawbacks that we found out is that perhaps it's so that if we consistently and use this for all of the encounters with the patients, perhaps in the future the ability to summarize and prioritize may decline. There's some literature on scientific literature on this also. And what also might be a problem is that if you have over-reliance on AI, there's always, even though if you control the prompt, there's always a chance for hallucinations. The potential benefit is, on the other hand, that when you are listening to patients, you might not always pick up everything. So the AI may actually highlight details that we humans might not record. There are a few Congress papers published on this project, and there's writing going on the real scientific journal paper. And I've got a PhD student, Mikko Reinikka, working on this. Okay, the next one that I want to mention, and this is something that I'm really excited about, is HOLA 5G Oulu project, which is a private 5G network operating in a real hospital environment. And it was the first European hospital powered by a private 5G network. And what it was, as mentioned, it's Europe's first. So we have a private 5G standalone network deployed in fully operational Oulu University Hospital. We also have, as mentioned, the real environment. So we do have authentic research and development with actual hospital premises, with the walls and all sort of like medical equipment and things going on. We also have the real medical staff and live clinical data to be used. And it has world-class partners for this Boldin network, Vicoar Technologies, and our university and University Hospital. The short-term goal for this project was to establish a private 5G network and develop wireless wearable technologies in selected areas in our hospital. And we did rigorously testing of the network and also the usability of these solutions to ensure streamlined workflows and smooth integration of these solutions to hospital environment. And that was the first thing. But the long-term goal is to expand the network to cover the entire hospital, enhancing patient care and operational efficiency, and serve as a model for other hospitals globally if they want to do this. And we also want to act as a technological hub for research and turning futuristic innovation into reality, and also transform healthcare operations. So there's next steps coming up. And things that we are now looking at the edge, which strongly relates to the 5G, also AI, robotics, data visualization, predictive patient care, and developing the whole ecosystem around this. One of the projects that's going on in our university is the edge computing in medical imaging, which means that we move the image processing or data processing closer to the patients, closer done in hospital when it's appropriate. and we have shared edge devices, and they efficiently enhance existing workflows of data, and also self-sufficient local clusters. What are the highlights from this project is that it's a Nokia modular private wireless network designed for medical environment, and it's seamlessly connected, maintaining even during power outages. We have massive device capability. These 5G networks support millions of connected devices per square kilometer, and it surpasses Wi-Fi capability way. And we also can deliver consistently in under high load. And it's also the security is integral part of these solutions. We have managed to get some awards for this from the European Digital Connectivity and also Leading Lights Awards. And I'm just like presenting this, but these are the guys who really worked on this. Petri Parviainen from Goldin, Jani Katisko, who is I think the mind behind this project. He's our clinic's medical physicist. Erkki Harjula, he's associate professor in technology. Our professor of neurosurgery, Mikael Fraunberg, Rauno Jokelainen from Vikoar, and our research nurse, Kirsi Rannikko-Korhonen. Okay, and for the last period, I want to talk about a few other projects. This was, to my knowledge, the first like real AI projects in our university hospital. It was called GUARDS, an AI-based decision support system developed in Oulu. It was an application that assists not to make diagnosis, but to help the radiologist to interpret by retrieving previous similar cases. So it can find out that, okay, we have similar images from these cases and also the reports from that. So it was like augmented intelligence. And there are papers from that project also. Currently, we have a lot of things going on, both in the hardware side as the software side. And there's a Midas group working on these things in our university. There's a picture from those. They include deep learning-based synthetic MRI, imaging biomarkers, deep learning-based denoising of the imaging data, AI-assisted patient positioning for X-rays, breast cancer screening, and radiation visualization, or radiation therapy visualization. And a lot of partners going on. This is an exciting because now we have actually moved on the phase where we are no longer studying method development only, but also the impact and implementation of these methods in the real healthcare work system. And this is one of the solutions that we have actually now picked up. It's called AG Trauma. It's not developed by us, but bought by us. And what it does, it summarizes the X-ray images if there's a suspicion for fracture, effusion, or dislocation. There's like image, and there's the AI thinks that there might be a fracture, and if you zoom it out, I actually think also that there's a fracture. This, nothing to worry about, no suspicion of effusion, fracture, or dislocation. And this, the AI has high suspicion that there is a fracture. And if you compare these two sides, yeah, totally agree. And this is now in practice. It's been used over a year now. First, it was a free trial. Now we have paid for it. And it identifies fractures, dislocations, and effusions from X-ray images. Our process is that it determines in advance, or we have determined in advance what images we want to send for it. And it's lip and joint images requested by emergency department. And only adults, not pediatric patients. And the referring physician makes referral normally, and the X-ray technician takes the image as usually, and the AI interpretation is added to image archive as a separate image for all those images. And the referring physician can request human radiologist's opinion either immediately, beforehand, or after seeing the AI, if he wants a second opinion. So radiologist does not routinely view images interpreted by AI unless the attending physician specifically requests this. And our preliminary experiences, one thing to mention is Elias Vaattovaara. He's doing his PhD project on this. And radiologists seem to like it. The interpretation is quite accurate. It has CE marking, and the workload in emergency room is reduced. As we can see, the numbers are quite big. We already have a sample of 2,600 X-ray images. About 68% the clinicians are happy with the AI interpretation. Nurses like it because it doesn't change their workflow at the moment at all. And there's research going on what would be the next step. And one of the questions, of course, is that we are now wondering how is the effect on doctors' training, and what are the ethical considerations? Can patients really choose that AI does interpretation for their images? Next, for the last minutes, I have to mention a few words about our solution that we have been developing with a few friends of mine. It's becoming a small startup. But for the reason that I want to talk with you about this is that I think it's a great example how we can have a problem that is annoying clinicians and that can be addressed with current solutions that are actually already there and not without large language models. So the problem that we face is that currently there is a lack of optimal methods for collecting quality data. Most data that we have are unstructured and in hard-to-use format, and clinicians hate entering structured data. It's just that we found out. And our approach, or the question that we started is that could AI do it? And the answer that we found out, yes. And the large language models are not always optimal solution. And this is not, we're not the only one who thinks this way. These are NVIDIA researchers, and this paper was published in September. And it's about AI agents, but these two principles actually work quite well in other use cases. So prioritize small language models for cost-effective deployment, and also leverage these small language models for rapid specialization. And we found out that this is a way to do. The other thing that I want to mention is that there's a lot of different things in machine learning that we should not forget. These are all good methods for selected purposes. And what we have now done is we have developed application and trained language model, a small language model, which does the boring quality and statistical data collection from us. Our solution is integrated in e-området system at the moment and already in pilot phase. And this is actually a screenshot. I'm sorry that it's in Finnish, but it's the eye surgery patient, and it states that there is a glaucoma and it's in sister, also brother. So it's quite certain that it's 100% certain that there is a glaucoma in the family. And also it states that there's a glaucoma in the patient. It's almost as certain about that also. And then there are the findings of the patient. And then there's that the patient have had the surgery for this. There's also we can collect, as mentioned, structured data from free text. This is an operational description, how it went and what happened during the operation. And there was actually a complication. And it collects this data. And what we can do from also the summary of the ending. And we can also connect and automatically pseudonymize because they were finding out that there are things that are like PDFs from actually taken or scanned images. So it can read the images, straighten it up, and do all sorts of pre-processing and then collect the data from that. And after we have collected the data, we can easily use it visualization, detailed analytics, and integrative dashboards for the clinicians to use. And this is not a medical device because it's not aimed for the single patient treatment, but for like doing better in overall and managing the patient workflows and that sort of stuff. For the last minute, few ads that I want to mention. We are now developing Oulu medical data infrastructure, OMDI, And we have actually had preliminary talks about the possibility that Outi or some other from this project would present you about this in the future or springtime webinars. And what is the main in this project is that we actually lack capabilities for doing secondary healthcare data analysis with AI because of the lacking of computational power. And this is one of the main things that we want to solve in this project. The other thing that I want to mention is the next summer we have a second Nordic conference in digital health and wireless solutions in Oulu. And there's a call for papers going on. So there's a link for that over there. So if you want to visit Oulu, please do. And it would be nice to see you all there. So thank you. I've spent my time, and I want to thank my group and all the researchers in both Oulu University and the University Hospital Oulu. And if you have any collaboration wishes or some questions or so, please connect me. Thank you.